Hi everyone, welcome back to another episode of the Breast Cancer Physio. I'm your host Jen McKenzie, lymphedema physiotherapist and ESSA accredited exercise physiologist. I want to talk to you about an event that happened at my clinic a couple of weeks ago that is actually quite unfortunate. Unfortunate in the context for the aftermath and outcomes for patients with breast cancer. About a month or so ago, my brother and I decided to put on a GP education evening at our clinic. And the GP education evening was going to be about the role of physiotherapy and weight loss after breast cancer. Because Andrew and I really feel quite passionate about educating our local medical professionals about the roles that allied health professionals can play to improve outcomes for patients after breast cancer. So we did a 250 flyer drop to local medical professionals around the Sunshine Coast, which is in Queensland, Australia. So we were really only looking for maybe 20 or 30 GPs to come to the event to actually run it. The really sad news is that we had a zero response to that invitation. Nada, zero, nothing. Nobody wanted to attend this event. And maybe you can blame bad marketing, maybe a flyer drop wasn't effective, maybe it was timing, who knows. But a couple of years ago, like 3 or 4 years ago, we did a similar event and we got about 30 or 40 local medical professionals, including nurses that were in the cancer space at the time. So 3 or 4 years ago, this event was not a problem to run. I'm not sure what's changed, and I spoke to a couple of colleagues about it and they were saying, oh, it's probably COVID. I think the GPs are really just so exhausted from COVID. You know what I feel like saying to that? Everyone's exhausted from COVID and it's time to move along from COVID and get back in the groove. I really am quite devastated that our local GPs were not interested in attending this event. But maybe it also highlights that they might not feel it's that important to know about the aftermath of care for breast cancer patients. I'm not sure. But at the end of the day, it's a little bit of a worry because when you finish active treatment, you know that your medical team essentially disappears to a large extent. Doesn't mean you can't contact them, doesn't mean you can't go and see them if you've got an issue, but they're not there with you so much of the time like they are in active treatment. A lot of the nursing staff have disappeared as well, and that's a natural progression. I'm not suggesting that they should stay around. They've got other patients that they've got to move on and treat. So your GP becomes a very important person in your medical team because they're your first port of call if something pops up. Of course, you can directly contact your breast surgeon or your radiation or medical oncologist if you needed to. But a lot of the time, what also happens is that women have this feeling that they really don't want to bother their medical professionals because they're probably busy treating the next patient with breast cancer. Am I right? Who's felt that feeling before? Women do tend to go, oh, there's probably someone worse off out there than me. I won't bother my breast surgeon, oncologist, whoever. So that's not necessarily the right thing to do, and that's not necessarily what this video is about today. But the reason I want to talk about the role of the GP is because we really need to upskill our GPs. I saw a lady in the clinic last week who came in with a lot of tension across her chest wall because she's had a bilateral mastectomy, so she's had both breasts removed, and naturally she's got a lot of scar tissue across the scar site and just the soft tissue around the scars. And she went to see her GP about it, and unfortunately her GP recommended to rub anti-inflammatory cream into her chest. He didn't suggest physiotherapy, he didn't suggest stretching, and this is the problem. I'm not saying that I'm pointing the finger at the GPs and saying, goodness me guys, like you're doing such a bad job. Far from it. I'm just saying that we need to upskill GPs so they're better equipped to know who to refer to for patients who are dealing with the aftermath of breast cancer care. So if you've got a GP and you're going to use that person as your first port of call if anything pops up after your breast cancer medical team has left the immediate space, then I would recommend that you have a sit down with your GP and just ask them what they do know about the aftermath of breast cancer. Because if the answer is not much at all, then it might be time to see if you can find a GP who has a special interest in breast cancer, because they probably do exist out there. If your GP is someone you're generally just not quite happy with, because when you go to them, they're not really leading the way, you're having to bring up what referrals you would like, you're having to ask for blood pressure tests, or, basically push to get your care, then it might be time to look for a better GP. A lot of patients come to me very frustrated with their current GP because they feel like they need to ask all the questions rather than the GP leading the way. You really want a GP who is passionate about helping you get better after breast cancer. There are so many things that pop up after breast cancer, like fatigue, lymphedema, or just being at risk of lymphedema. There is loss of muscle mass and loss of strength. There's also things like peripheral neuropathy after chemotherapy that still need to be dealt with after your treatment is finished. There's so many issues after breast cancer that can carry on beyond active treatment. Think about all the emotional health, sexual health, and physical issues that you can still continue to cop after your treatment is finished, that if your medical team is not there to help you with, your GP is going to be someone that should be able to triage you off to the right allied health professional, industry expert, or specialist that can help you in that area. So what I want you to do is really have a hard think about whether or not you've got really good trust and faith in your current GP. If you don't, consider looking elsewhere for a better GP. Ask friends, family, and colleagues if they've got a good GP, and see if you can't get yourself to someone who is going to be really passionate about helping you create version 2.0 of yourself after your breast cancer treatment is finished. The other thing you can do, of course, is show them this channel if they're wondering about what the role of an allied health professional is in breast cancer. There's lots of good videos on my channel about that, and there's plenty of other good resources out there that you might be able to show them if they are genuinely interested in helping you get better. Thank you so much for watching this video, guys. I hope you gained some good information about why it's so important to have a good GP after breast cancer. I've got a massive announcement coming out next week about a new online program that I'm creating. So please get on board next week and watch my video, because I'm about to show you everything that's involved with that program. And I'm really, really excited about this one. This has been a project I've been working on for a little while, and it's hopefully going to really change the game in terms of how you can access me and my knowledge and expertise in the area of breast cancer. Thank you so much for watching. I hope you're having a fantastic week wherever you are. I'm Jen McKenzie, the breast cancer physio, and I will see you next time.